This is a podcast from WOR.
The following is a paid program sponsored by Raritan Bay Medical Center, a New Jersey-based hospital in Perth Amboy and Old Bridge, New Jersey. WOR's airing of this program constitutes an endorsement of neither the opinions expressed nor of the products offered. Welcome to Health Navigator, the show that helps you understand the latest healthcare trends and learn to separate the sound health advice from the hype. Now, here's the host of Health Navigator, Abe Casbo.
Hey, welcome everybody. This is Abe Casbo, and you're listening to Health Navigator right here on WOR. Health Navigator is a show that delivers the best possible information, that provides you with the best possible information, so you can take control of your health and wellness. And the show is sponsored by Raritan Bay Medical Center in Perth Amboy and Old Bridge, New Jersey. And check them out at rbmc.org or on Facebook. I got to tell you, they probably have one of the most informative Facebook pages, that I've seen in terms of meaningful healthcare information that I can use. So give them a like at facebook.com/myrbmc. So, listen, another Sunday night. Again, I apologize. I haven't been able to kick this in a couple of weeks. So I apologize for my raspy voice again. But for those of you guys who know from last week, I went to Chicago on a business trip and came back with a nice souvenir. Chicago is a great town, but I really do wish I didn't pick this thing up. It's been hard to kick. We got a great show for you guys today. We've got Dr. Kumar Dasmapatra. He's the Chief of Surgery and President of the Medical Staff at Raritan Bay Medical Center. And we're going to talk about a couple of things. I think in our first segment, we're going to talk about the advances in laparoscopic surgery and really how physicians and surgeons are using laparoscopic surgery to get us back into the groove faster and better. And we're also going to talk about the relationship between the doctors and nurses within the hospital and how that could impact patient care. It's absolutely critical. It's something that happens behind the scenes, but it really has an impact on how well we do within the hospital. So we're going to be talking with Dr. Dasmapatra about that. We're also going to be talking with Dr. Eugene Isola. He's a general dentist, and we're going to talk about a bunch of topics, including bonded white fillings and bleaching and implants and migraines and TMJ, all the things that revolve around the mouth. And I'm particularly interested in because some of the technology. You kind of worry about what you're putting in your mouth. So we're going to ask Dr. Eugene Isola about that. And our third and special guest is Alon McAllister. Alon is the Executive Director of Choices in Childbirth right here in New York City. And it's a nonprofit agency that helps women and families throughout the period of childbirth to give them both education as well as provide the choices that they need to make a really good decision when they're giving birth, because it's certainly a frightening time for mom and family, and so we're really excited to have Alon on the show. So please stay with us. We're going to be right back after these words from our sponsors.
Is joint pain, limited mobility, or a sports injury stopping you from living your life? At the Human Motion Institute at Raritan Bay Medical Center, their goal is simple: to return you to normal function as quickly and safely as possible. Their team of experienced orthopedists, surgeons, and physical therapists, along with your very own nurse navigator, work with you to develop a customized treatment plan to get you back to the activities you enjoy. By combining extensive clinical expertise with a compassionate, caring treatment philosophy, they have created a program known for its quality of care. To learn more about the Human Motion Institute at Raritan Bay Medical Center, call 855-566-8466. That's 855-566-8466, or visit www.rbmc.org.
Welcome back, everybody. This is Abe Casbo, and you're listening to Health Navigator right here on WOR. Health Navigator is proudly sponsored by Raritan Bay Medical Center in Perth Amboy and Old Bridge, New Jersey. Check them out at rbmc.org, and on Facebook. They do a great job on Facebook, folks. There's a lot of healthcare information that you can actually use that they put up there. So check them out on Facebook at facebook.com/myrbmc. And it's my pleasure to welcome Dr. Eugene Isola. Dr. Isola is a dentist at Raritan Bay Medical Center. Welcome to the show.
Yeah, how you doing?
We're doing great. Tell me a little bit about what you do at Raritan Bay Medical Center, Dr. Isola.
Yeah, well, I'm a general dentist here, located in the Medical Arts Building, and I'm a full-service general dentist. Do everything from cosmetics. We see children, and we basically do all phases of general dentistry.
I wanted to talk to you a little bit about bonded white fillings. I know it's not, the most riveting subject in the world, but I wanted to talk to you about that. Can you tell me a little bit about the latest and greatest in bonded white fillings?
Sure. Well, bonded white fillings or resin-type fillings are, a product that's been around a long time, since the 70s, but, the evolution of the material has come a long way. One of the important things to know about white bonded fillings or tooth-colored restorations, as we call them, are that, they are very technique-sensitive, and there are many different types of materials that...
Well, when you say technique-sensitive, what does that mean?
Well, again, you can go to 7 different general dentists or even specialists, and if they're not trained properly and using the latest and greatest techniques, a lot of times you're not going to get a good product.
The result, right?
Yeah. So that's a large variable in the success of the outcome of that procedure. And, if you talk to different patients, you'll get, if you talk to 10 different patients, you may get 10 different responses with what type of experience they had with those kind of fillings.
Right.
So, it is very technique sensitive. And, again, even the materials, they have microfilled, macrofilled, all these different hybrids that come out there. And, again, if the...
Are these materials, are they safe to be put in our bodies?
Well, that's the great question. Does the old standard amalgam or metal filling versus the white filling, what's safe? And there's people are very concerned about mercury toxicity, and rightfully so. But the thing on plastic fillings or resin fillings really hasn't been determined, because there hasn't been any 50-year studies out yet. So I'm sure that there is a little bit on a small level of toxicity that does get into the system. But, again, if the restoration is done right, whether it's metal or plastic, usually there's very minimal toxicity related to the body on a long-term basis. That's what studies show. And they do teach that at the dental school. I am an associate professor at UMDNJ. And, they're still very confident with both type of fillings. Again, technique-sensitive, material-sensitive is the key.
Got it.
Yeah.
Now, does the same hold for bleaching? Because, sometimes I look at these folks and they've got these, gleaming white teeth, and you kind of want that. But then, you read that some of the stuff, you really have to be careful with it. Talk to me about the bleaching technology that we've got these days, and whether it's safe, and, what your professional opinion is on it.
Sure. Well, again, bleaching has also evolved a long way, and again, the materials have gotten better and better, and a lot more effective. There's in-chair bleaching, where you would come in and spend a long time in the office sitting there, and they can amplify the result by using certain lighting and increase the speed of getting the result you want. But sometimes that can be a lot more harmful to the teeth, because you're kind of rushing the event, and you do have a lot of post-operative sensitivities with that.
When you say more harmful to the teeth, how is that more harmful?
Well, bleach is just, what you're doing is you're taking a chemical, and the chips are being embedded into the teeth, into the inert part of the teeth, the non-organic part of the teeth, the enamel. And basically what that does is it captures the light and reflects it back in a different way, so the teeth appear whiter. Another important thing to understand about bleaching is that none of it is permanent. So that there's always going to be maintenance involved, whether it's done 3 hours in the chair or you do it at-home bleaching kit with trays over 10 days to 14 days. You're always going to need touch-ups. So that's an important thing that a patient should know when getting bleaching, that there is going to be constant maintenance. So, patients will come in and they'll bleach their teeth, and then they get some permanent restorations, and unless they keep up with their bleaching, their teeth are going to fade back to their original color, and things won't match.
What's a reasonable time to expect that a bleaching would last?
I would say, again, depending on all the habits, smoking, and soda and coffee.
Drinking.
But, probably every 3 to 6 months, you'd have to do some touch-ups where you might have to wear a tray at home for 2 or 3 nights. or 3 to 5 nights, depending, to get you back to the color that you'd like to be at. And as far as them being harmful, if it's used in the right way and you're not overloading those trays and you're swallowing all this stuff, if it's used in the right way, it's very safe.
Right. And are you seeing, I mean, there seems to be an explosion in teeth whitening, right? I mean, because talk about social media. All you have to do is see somebody else with beautiful white teeth.
Yeah. Well, again, I think that everybody is a little more self-conscious about their appearance these days, and whitening, sure, bleaching and whitening is certainly a safe, effective way to do that, as long as they understand that there's going to be that maintenance involved. And it doesn't work for all cases. There are some times where you have very intrinsic, deep stains in the teeth, say from tetracycline and things like that, and bleaching really isn't a good selection for those patients.
So I guess bleaching is also part of a process of oral health, right? Because you can't get to, right now if I haven't been to the dentist in a year, it's not like I should go there and say, okay, bleach my teeth, right? You've got to go through a cleaning and
yes, you want to make sure
right?
that we have a healthy soft tissue, the gingiva and the soft tissues in the gums are all healthy and sound, and you certainly wouldn't want to do that on any kind of compromised patient. You'd want a very healthy patient. That would be something you would do after the initial treatment and getting them back to good oral care, and then you'd want to bleach your teeth. That's true. Yeah.
All right, what we're going to do right now is we're going to take a break. When we come back, we're going to pick up our discussion about some of the technologies in dentistry. Great. Stay with us. We're going to be right back after these words from our sponsors.
At the Center for Women at Raritan Bay Medical Center, they are dedicated to the special needs of women, a comprehensive approach to breast health, wellness, and disease prevention. With locations in Old Bridge and Perth Amboy, their newly renovated facilities combine the highest quality imaging technology with comfortable spa-like surroundings and a uniquely personalized level of care. They make it easy and convenient for women to receive state-of-the-art testing, including mammography, ultrasound, breast MRI, image-guided biopsy, and bone densitometry, along with various other women's health services from holistic medicine to lymphedema therapy. When you walk through the Center for Women's doors at Raritan Bay, you will work with your very own dedicated nurse navigator who will guide you through each step of the process, whether you're there for a screening mammogram, a series of tests, or treatment for a chronic condition. To make an appointment, please call 732-324-5270 and learn more at visitrbmc.org. And be sure to listen every Sunday night at 10 p.m. to Health Navigator right here on WOR Radio. The region's best-kept secret in medicine is a secret no more. Here's why some of the best minds in medicine are coming to Raritan Bay Medical Center to care for you and your loved ones. Nationally recognized cardiac care services. Raritan Bay Medical Center has received the prestigious Get With the Guidelines Heart Failure Gold Quality Achievement Award from the American Heart Association. The Center for Sleep Medicine at Raritan Bay Medical Center was named Best of 2012 by Sleep Review's Sleep Doctors and Facilities list. If you have chronic insomnia, a better approach may be to remove the cause by changing your lifestyle. Call them to learn more about how they can help. Along with dedicated and Magnet Award-winning nurses, everyone at Raritan Bay Medical Center knows that they care for people, not patients. What are you waiting for? To find a Raritan Bay Medical Center physician near you, visit www.rbmc.org or call 1-800-DOCTORS.
Hey, welcome back, everybody. This is Abe Casbo, and you're listening to Health Navigator right here on WOR. Health Navigator is sponsored by Raritan Bay Medical Center in Perth Amboy and Old Bridge, New Jersey. I also want to say, look, Raritan Bay Medical Center did a wonderful job this month and in the beginning of the month for this for the Go Red campaign. So I want to give a shout out to everybody at Raritan Bay Medical Center who did a fantastic job in raising awareness of cardiac disease in women. But I want to get back to our special guest who's with us, Dr. Eugene Isola, who's a dentist. Dr. Isola, let's talk a little bit about implants and dental implants. And these things look fantastic these days. They don't look anything different, or they look 100% different than what they did, like, let's even say 10 years ago. How are they doing it?
Well, again, you have a technology-based culture, and that affected the field of dentistry also. So the implants have become so reliable and predictable that and we're so comfortable placing them these days that it's actually better in many cases for people to restore their teeth with an implant, especially a single tooth restoration. It really preserves the adjacent teeth. You don't have to grind the adjacent teeth down to do the traditional 3-unit fixed bridge. So it's really become a predictable alternative for people when they need teeth replaced. So that and the additional advances they've made with the porcelains and the types of porcelains that they're using. Several different companies have made some really great changes to these things, and the product has just gotten great. Teeth really look natural.
Why would I choose an implant today over what would be my alternative?
Well, again, basically what I tell my patients is that when you're missing teeth, you really have three alternatives. You can make something somewhat inexpensive, a removable type of prosthesis that could be made that has to come in and out of your mouth and just clasped onto the adjacent teeth, so to speak. The other alternative would be the more conventional approach, which would be some fixed-type crowns, where you do have to grind some sometimes healthy teeth down to anchor the missing teeth, and that would be called like a fixed bridge or crown-type restorations. And then third, you'd have an implant option, and the beauty of that is none of the other teeth have to be touched. So, especially when you have what we call virgin teeth adjacent to a space, those teeth can be left alone. And certainly if that was my situation and I was a patient, I would pick the implant because it's the best we have to offer today.
Got it. What about it? What about migraines and TMJ? Because that whole area also, the mouth area is affects the migraine situation. So, can we talk about that?
Yeah, migraines and TMJ just means the temporomandibular joint. So when people say I have a TMJ, they're right. Everyone has a TMJ. So basically we're talking about temporomandibular joint dysfunction and or pain. And a lot of times that's not only related to a person's bite, but there are other factors that can cause some pain in especially the temporal area of the head or the side of the face, sometimes even down into the neck. And those can come from bad habits like clenching or grinding. Sometimes people are even clenching and grinding during the day, not always even in their sleep. So those things can contribute to that, and as well as having an unbalanced bite, so to speak.
But what could you do as a dentist to help someone?
Sure. So first we would want to determine what the actual cause is.
Right.
And then once we have that, certainly if it's a habit, which in most cases it is, we have these what we call bruxism plates or grinder plates that can be worn. They're not permanent. They come in and out. And again, the evolution of those things has come in such a long way that some of these companies have gotten, and some of the research that's gone into it, they've come out with such great products. The trays are very, very comfortable, easy to use. They stay in well, they're retained in well, and we get fantastic results with relieving some TMJ and migraine head pain. And
how long does it take? What's the course of treatment like?
Well, basically, a patient would come in, and once we have the diagnosis correct, then we would take some molds and send it to a laboratory and have the custom tray fabricated, and then the patient would come back pretty much within a week or two, and we would have a fitting, and generally they can take the tray home that night. That, along with some home care instructions about diet and opening and some other key things that we give them, they'll wear the plate as we direct them, mostly at night and sometimes even during the day in some cases. And we get relief pretty quick, within a week sometimes, although, sometimes it takes a bit longer. And it's the kind of thing where they can, after maybe a month or so, when they get some good relief, they can use it as needed kind of thing. Right. In most cases. So it's a great thing to have because that's the kind of thing that does come back cyclically.
Dr. Isola, if you were talking to a loved one or a family member and you were giving them advice on how to select a dentist, what would you say?
Well, I would say, I guess basically use common sense. I mean, first shop around. That's the society we live in today. Everyone wants to get more than one opinion, especially if you're going to spend a lot of money. I always welcome my patients to get another opinion. I think it's a great thing to do. Shows you that at least you're comparative on pricing, and also a lot of times you get what you pay for, and if you use your spidey senses, so to speak. You know, what it looks like, what it smells like, what you see when you're in the office, if things look up to date and modern. You know, electronic charting, digital X-rays, all these kind of advances really help us do a better job.
Right.
You know, when I went to dental school years ago, people weren't even wearing loupes, or, you know, gloves were just coming out in the 80s and things like that. I mean, you know.
Yeah, well, infection control is a big deal in your business, too.
Yeah, absolutely. And those are common sense things. You're going to see that right from the minute you walk in somebody's office. Is it clean? You know, these are just really small factors, but really are big ones. So, but you certainly, you know, shop around them and you know, make sure you're comfortable with that person and make sure you trust that person. And, you know, that's my advice, I guess.
Right. Well, Dr. Isola, thank you so much for being on the show.
Yeah, thanks for having me. I really enjoyed it.
All right, we're going to be right back after these words from our sponsors. Stay with us.